Hi there, this is Dr. Gwendolyn Buck from Northern Trails Dental Care. I'd like to share with you some options for treating gum disease. Some people find that no matter how much they clean their teeth in between and brushing, and no matter how many times they see their hygienist in the year, they still wind up losing ground and losing bone with their periodontal disease. And today we have a lot more options for treatment than we did in the past 50 years. So one of the things that's an option is something called a diagnostic salivary test. And it's a really easy and inexpensive test where we find out what specifically is causing the infection in your mouth. So it'll give us specifically which bacteria are there and also a guide as to which antibiotics are appropriate to treat those, which we do in conjunction with the disinfection protocol with your hygienist. We also can test, if you have the curiosity to find out, what your genetic risk is. Now, that's an option in our office, but we usually use the bacteria test because we can usually tell clinically and from what a patient tells us of their health history if they're genetically high risk or not without that test. We also have the option for something that can be really, really helpful. It's called PerioProtect trays. And this is a specially designed tray that's really intimate with your teeth and gums, where you put a special hydrogen peroxide gel in, and that hydrogen peroxide gel is gently pushed in between the sulcus in between your gum and your tooth. And that is really effective in reducing the bad bacteria in your pocket. Another option for gum disease, which took me a while to really understand myself, was a bite guard. And the two things, immediately they seem completely unrelated, gum disease and tooth grinding. But then someone gave me a scenario and they said, if you take a fence post and you wiggle it and you wiggle it and you wiggle it, eventually that post is gonna get loose and sometimes it'll just come out. So that scenario really makes sense when you're talking about teeth. And when you have a little bit of bone loss around teeth and you've lost some support, and then you start grinding on them, that can really make a difference for future bone loss. So some people, that's really appropriate to wear a night guard to just really try to not lose any more ground. So make sure you talk to your hygienist, talk to your dentist about the options for you if you just feel like you're doing everything possible and there's still not as satisfactory results as you'd like.